Hey everyone, this is Dr. John Burroughs at Springs Aesthetics. I wanted to briefly talk about neck rejuvenation and ways to do it in the office that have minimal risk, minimal downtime, and you don't even have to be knocked out to have it done, but still can be very comfortable. So this is what I would call a minimally invasive approach as compared to a surgical approach for neck rejuvenation. And this patient, like a lot of us as we get older or have inherited from our parents, don't want to have this slope just behind the chin down to our upper chest area. A more youthful look has what's nicely called an acute cervicomental angle. Also, from the front, none of us wants to have a lot of fullness here from fat that's accumulated, or again, an area that you've inherited from your parents that you all in the family tend to carry in that area. So this patient's goals were to have a surgery that could be done as an outpatient at the office, give real results, have a short downtime, avoid sutures, and to have a quick recovery. So what we did is we did some neck liposuction through a small port similar to this one that hooks up to an aspiration device to pull the fat out that you break apart. We also did, through 8 small puncture sites in the skin, a MyEllevate suture neck suspension and contouring. So it uses a suture that's been used for decades, and it's weaved underneath the skin tissues above the what's called the platysma muscle to redrape and pull upward. That works amazing. It's done through these small little puncture sites, and it's weaved back and forth almost like a hammock to pull it up very nicely. The suture's been around a long time, and it's worked well in surgery, and patients do just fine with it. The nice thing about this is there's no incisions that have to be done that are large and require lots of stitches. And again, it's just done in the outpatient setting and can have 5-year or more suspension results. Also, oftentimes we will want to tighten the skin, not just redrape it. So if you're an older patient and you have a lot of loose skin, not just some that's hanging down, this is our face-tight radiofrequency tip that also goes through small holes. Works great in conjunction with liposuction because it tightens the skin at the same time that you're removing fat. Because if all you do is liposuction and don't do anything to the skin, you're going to have a problem with too much skin. And that is seen with a lot of patients that get Kybella and things of that nature. The other nice thing about this is a one and done for several years. So it's nice to be able to get something that's done quickly, done in an outpatient setting that you can get back to activities in a quick manner, but also have nice results. Now, lastly, I'll mention, though, this patient didn't have is the microneedle radiofrequency treatments. And you can see, I hope, these little needles that come out, and you can turn up the energy in areas where there's a lot of fat to cause destruction of that fat, which will then get resorbed into the system and goes away. The microneedles also, because they go through the skin, tighten the skin by causing very controlled little areas of injury that lead to collagen and elastin production. So this goes under the skin, this goes through the skin, and they work great. Some patients, that's all they do. But if there's a lot of tissue that's hanging down, or nectosis, if they want to get that nice cervicomental angle they once had, and they want this full area addressed, you got to do a few extra steps. So this patient had the MyEllevate suture suspension. She had NeckTite and also the liposuction done with that. She is thrilled with her results. This was approximately a 3-hour procedure. You can do it with just oral sedation, or some patients that are more anxious, they can have a little bit of IV sedation help. It is amazing. It's been a game changer in my opinion in aesthetic neck rejuvenation. And it avoids the big incisions that used to be done quite a bit. The other nice thing about it is if you have the platysmal bands, I'll show you, although it's a little embarrassing. See those bands there? You can address those bands with the MyEllevate all through the skin. So basically, if this is the band, you go above it in one pass, then you come back behind underneath, and then you use the suture almost like a jiggly saw to sever the band. And then once you redrape it up, you get a good long-term improvement of where those bands had been. So this is the patient about 6 weeks out, and she is just thrilled with her result. So I wanted to share that with you. It is a very popular procedure that I do now at Springs Aesthetics, as it gives real results, good long-term results, and it has a quick downtime, and you don't have to undergo general anesthesia. So I hope everybody's doing well. I hope you found that interesting, and everybody be well and be safe. Thank you.